You have seen one in every hardware store, every autumn, every construction site, every storm cleanup. The chainsaw is one of the most recognizable tools in the world, and almost everything you assume about where it came from is wrong. Ask anyone what the chainsaw was invented for. The answer is almost always the same: timber, logging, forests. It is the image burned into culture: the lumberjack, the wilderness, the roar of a two-stroke engine biting through wood. That association is so strong, so complete, that most people have never questioned it. But the chainsaw was not born in a forest. It was born in an operating room. And the material it was first designed to cut was not wood. To understand why the chainsaw exists, you have to understand what surgery looked like in the late 1700s. There was no anesthesia as we know it today. There was no understanding of infection, no antiseptics, no germ theory. Surgical speed was survival. The faster a surgeon could complete a procedure, the smaller the window for shock, blood loss, and the kind of contamination that no one yet had a name for. And some procedures required cutting through bone, not just the soft tissue that a knife could handle. Bone. In the era before power tools of any kind, that meant a handsaw. A slow, imprecise, exhausting hand saw. On a conscious patient, or one rendered barely insensible by alcohol. In the 1780s, two Scottish surgeons, John Aitken and James Jeffray, confronted a specific and terrible problem. During complicated childbirths, when the infant could not pass through the birth canal, surgeons sometimes needed to cut through the cartilage and bone of the pelvis. The procedure was called a symphysiotomy, and performing it with conventional instruments, slowly, without precision, in extreme conditions, was dangerous for both patient and child. Aitken described a solution in 1782 in his work on midwifery and surgical practice. A fine chain, edged with small serrated teeth, stretched across a thin guiding handle. Moved back and forth, it could cut through cartilage and bone faster, more precisely, and with less trauma to surrounding tissue than a conventional saw. It was small enough to be guided carefully. It was efficient enough to matter when every second counted. Jeffray later developed and refined the concept further. The instrument they created was called the osteotome, and its chain and guide mechanism, a serrated chain wrapped around a directing blade, is the direct mechanical ancestor of every chainsaw running today. Sit with that for a moment. The device was not designed for a forest. It was designed for a body, for cutting through the bones of a woman in labor without anesthesia, in conditions that would be unrecognizable as medicine to anyone alive today. The osteotome was also used in other bone surgeries, the removal of diseased or damaged bone, amputations, procedures where a conventional saw was too slow or too crude. All of this is documented. All of this happened. And the patients were largely awake for it. The goal was not cruelty. The goal was survival. The best outcome available in a world that had not yet discovered what made wounds become fatal, or what could safely stop pain. But the instrument those surgeons built to solve that problem. It worked. The mechanical principle did not stay in the operating room. Through the 19th century, as industrial manufacturing developed, as engines replaced muscle, someone eventually recognized what that chain and guide cutting mechanism could do at scale. If fine surgical teeth could move through bone efficiently, larger teeth on a driven chain could move through wood. The leap was not conceptual, it was engineering. By the early 20th century, the chain-driven cutting mechanism had migrated into forestry applications. Andreas Stihl, an engineer and entrepreneur in Germany, patented an electric chainsaw in 1926. 3 years later, he followed with a gasoline-powered version. Early models were enormous. They required 2 operators. They were machines, not tools, heavy, industrial, designed for the scale of commercial logging. The single-person chainsaw came later still, as motors became lighter and the design was refined across decades. Today, the chainsaw is so completely associated with timber and construction that its medical origin has been almost entirely forgotten. It sits in the garage. It appears in disaster relief operations. It is, in a certain cultural register, a symbol of a particular kind of American or rural working life. None of that is wrong. The chainsaw became those things genuinely, over time, through use and industry. But it began somewhere else. It began as a surgical response to an unresolvable problem. It began because bone was too hard and time was too short, and a surgeon needed a better way to cut. There is a version of this story that is told for shock value alone. That is not this story. What is worth sitting with is something quieter. The chainsaw is one of the most powerful cutting tools in everyday use. Its design principle has not fundamentally changed in 2.5 centuries, and it emerged not from industry, not from a workshop, not from a man who wanted to cut trees faster. It emerged from medicine, from 2 surgeons who looked at an impossible problem and built something new. The tool survived, the context did not. Next time you see one, in a hardware store, in a truck bed, in the background of something ordinary, you are looking at a shape that first existed in the 1780s, in an operating room, doing something no one expected a chainsaw to do.